So good afternoon, everybody. It is May 6th, 2 days after Star Wars Day, 1 day, 3 days after World Press Freedom Day. And if I'm not mistaken, today is also National Nurses Appreciation Day. So that is something we definitely can all get behind. So for today, we got a couple questions, but let's start out with the roundup. And Ryan, you're up. Where is Nevada County at?
All right. Yeah, thank you for having us again. I'm Ryan, the County's Health and Human Services Director, and as of today, we have 74,613 vaccine doses in arms of Nevada County residents. So that's huge progress over the last several months. According to the CDC's data and the state's data differ a little bit, but according to the state's data, around 50% of people over 65 are fully vaccinated, and around 10% have had one dose or are partially vaccinated. That's good progress, and that's the highest uptake that we have in any age group, but it's not nearly high enough, and we need to get more uptake in the other age groups as well, because we are starting to see a little bit of a slowdown in terms of appointments filling up and things like that. And if we have, I think as Dr. Kellermann pointed out in a media article, if we have 50% of our seniors that are fully vaccinated, that means 50% of them are not fully vaccinated and they're still at high risk. So that's the update in terms of just the stats. So thanks.
Thank you, Ryan. And welcome, Alinea. Dr. Stevens, welcome. Joining us live from Chapa Day. How are things going over there? How are vaccines going? Any news?
Thanks, Pascal. Yeah, so I think we're seeing the same thing as the county. We're seeing less people take us up on our offer to get vaccinated. We're worried as well as the case rates are going up in Nevada County about what that all means. So we are strongly encourage people to talk with their doctors. We'd love to have these kind of conversations if there's any questions you guys have around vaccination.
Thanks so much. Yes, that's definitely something. That and Nevada County is also, well, I believe the headline I wrote was firmly in the red tier, and Dr. Kellermann, firmly in the red tier, sliding towards purple if there hadn't been some changes.
Yeah, changes not by us. Some of the changes we've made is heading the wrong direction. Our case positivity rates about 3 times the state average. I think it's 4.3, and you know, we're I think not last, not dead last, but second or third to last as far as case positivity rate goes. You know, we have 10.7 per 100,000, and I think Stanislaus is 10.8 or something. So, and last week we were 8.7, and so we still encourage people in public health to, you know, our message is never changing. You know, it's rock solid. You know, wear a mask. You know, avoid indoor gatherings, and you know, close quarters, and wash your hands frequently. But primary thing is get a vaccine. We've opened up another clinic here yesterday. And clinics now, Whispering Pines and our clinic up at Sierra College is, you know, you take walk-ins. So if you say, I can't schedule, I don't know what my schedule is, and you just have, you know, free time, you got a half an hour off, go over and get immunized. But that's what's going to get our county out of this morass. Again, June 15th, the tier system will go away. The virus won't. And so we need to be ever vigilant, in particular with the new variants that seem to be cropping up. And Alinea and I have talked, you know, there's a disaster in India right now with, you know, case rates in, you know, 300,000 or 400,000 per day, which are supposedly vastly underestimated, with only 2% of the population immunized. I think with our vaccination rates right now, we're not going to see something like that. But we still need to be vigilant, particularly this time that, end of school year and people want to celebrate proms, dances, and things like that. We're certainly cautioned against that for public health.
And speaking of the complicated questions that are for Dr. Trochet, as per the instructions I got, the first question that was submitted is: any news yet on when, if Novavax will be approved and released for use in our area, and will that be available at primary healthcare physicians rather than only in pharmacies or other large group venues?
Okay, first of all, I do not know when Novavax will be approved. My understanding is that the phase 3 studies in the UK are done, but they're still finishing up the phase 3 studies in the United States and in other countries. So I am not aware if they have submitted their data to the FDA yet, and that needs to be submitted and has to be reviewed before it's anywhere close to having an emergency authorization. So unfortunately, I don't have an answer as to when it will be authorized. I can tell you that public health throughout California has been advocating for all the vaccines to be available at your doctor's office. Certainly, we are expecting approval of the Pfizer vaccine to be available for 12 years of age and older. And we would love to see vaccine available in doctors' offices for everyone, including kids ages 12 to 16. So we are advocating for that. In Nevada County, the health department would be very willing to act as the hub that would receive the vaccine and distribute it to family doctors, pediatricians, anyone who's willing to give the vaccine. We need to work with the state so that they agree to that, and we will be on our way.
Okay, thank you. And another question we have: what is the update in getting vaccine to unsheltered people or people who do not have transportation? Are housing vouchers available for aftercare? And if yes, how does that work? And is there any contact info? That might be a Ryan question.
Yeah, so we were well positioned going into the pandemic to have a medically focused homeless outreach team known as the home team. It's the it has a behavioral health nurse as part of that team, and they've been very actively engaging with our homeless community and trying to arrange for vaccinations in coordination with public health and our shelter and other key touch points. They are arranging for transportation. They're also arranging, I believe, for sheltering for aftercare for people. So I think the best way to arrange that for an individual person would probably be to contact the home team directly. And let me have the business card here somewhere. I apologize. Maybe we can go on and come back to me.
No, and I think anybody who wants to reach the home team, they can always call 211 if I'm not mistaken.
That's correct.
That is probably, and 211 has numerous resources, including the contact info for the home team. So probably the best way would be 211. I can also now furiously search on the county website and find the home team.
Yeah, and I've got it. So yes, definitely 211 for a variety of needs in assisting people. If there is somebody especially unsheltered homeless that you're trying to assist, you can call 530-470-2686, or you can email home@co.nevada.ca.us.
And there is that email address. And again, the Nevada County has, of course, the home team. And then for the harder to reach population, there's also the reach teams, right?
The reach team is quite extraordinary. There's 3 nurses, and they will arrange for immunizations. They'll go out to the house, and they will arrange for immunizations. They've worked their way down Highway 49, some of the trailer parks there, and some of the conjugate living facilities where transportation is difficult. And Ryan, I'm sure you got the phone number for that. Maybe we'll put it in the chat. But if you call the REACH team number, then they will contact you. One of the county nurses will contact you and arrange a visit so that we'll take care of your needs. I mean, we're well aware that there are people in this county that don't have access to health care and don't have, somehow not very ambulatory and more homebound. And we're well aware of that, and we're willing to meet their needs wherever they are.
And Dr. Stevens answered the question that Garnett had, that she put in the Q&A. What is the maximum number of unrelated vaccinated adults that is recommended right now for people getting together outdoors to dine and play bingo? And since it's an important question, maybe we can just repeat that here live in the chat. Alinea, do you want, Dr. Stevens, do you want to take it, or somebody wants to take it and tell us how many people can now get together outdoors?
So the link I put in there was all of the things you get to do when you're vaccinated that the CDC showed us. So that's really exciting. And eating outside with actually vaccinated or even unvaccinated folks is one of the things. So if all of your folks are vaccinated, you can have bingo and eat outside with them and even inside. So make sure to check out that link. There's some other wonderful things that you can do as well safely.
And just so everybody knows, the definition of fully vaccinated is having had 2 doses of either the Pfizer or the Moderna vaccine and 2 weeks after the second dose, or 2 weeks after the 1 dose of the J&J, of the Johnson & Johnson vaccine. Just so that everybody understands, you're not fully vaccinated immediately after your second dose or your dose of J&J. You have to wait those 2 weeks.
And can you comment on 2 weeks? That is for once that is a really firm deadline. So, but why 2 weeks? Is there a safety margin in there?
Well, yes, 2 weeks is the average. It's what it takes, how long it takes the average immune system to build the defenses after receiving the vaccine. Some people will probably be immune sooner than that, and a few people might be immune later than that. But we had to pick an average, and the average is 2 weeks. Okay.
And a local question is like, can you comment on where there are hotspots within Nevada County? As far if you can, because of course there are privacy issues and medical privacy issues, but I mean the Truckee High School, that's pretty well announced.
Yeah, I have to say that Truckee High School is not the problem. Actually one of the safest places kids can be is in school. They're wearing masks, they got the 3-foot distances, and it's well controlled, and teachers are 6 feet away. It's socializing. It's the social events, extracurricular things that are happening outside of school that tend to be the problem. So although you can say Truckee High School was never at fault, it was the fact that kids were socializing outside of high school in ways that allowed the virus to spread.
And I believe that there is some concern right now as well in Western Nevada County about various events and quote unquote proms that are organized. And as far as I understand it, none of the schools is actually having a prom. So it's all outside people and businesses that organize those. And it's not, I mean, prom is important, but is it that important?
Yeah, I would say that the hotspots in Nevada County is anywhere that people who are not vaccinated are getting together indoors without masks and without social gathering, without social distancing. So there are plenty of hotspots, but we can avoid them. And quite honestly, I would appeal to parents to look after the health of their children and not allow them to gather because most children are not yet fully vaccinated. So protect your children's health, have them wait until they're fully vaccinated. And when they and their friends are fully vaccinated, then they can get together. But until then, don't gather without masks, don't gather indoors, and keep your social distance. It's just a few more months to go before we're over this, if we all protect each other.
It's been, I mean, I know as the father of 3 kids that it's been a tough year to be a parent. It's been a tough year to be a kid. They have not had a normal school year, and they are missing out on a lot of things, and totally understand and empathize with the need to get back to normal. And the great thing is that we now have a powerful tool to do that for the kids who are old enough for senior ball and junior prom, and that's to get vaccinated. And they may not be able to have a normal end of their school year, but they may be getting to something close to normal for their summer and for their next school year if we can go out and get them vaccinated. And then the exciting news about next week, potentially Pfizer being opened up to kids 12 and older, expands that to an even greater group of kids. So.
And yeah, here's a question that just came in. So this person is willing to be vaccinated with a vaccine that is fully approved by the FDA, not just this emergency trial basis. So can we talk a little bit about emergency use authorization and quote unquote fully authorized?
Yes, the difference between first of all, the emergency use authorization is given on the basis of data. There have to have been studies, there has to be data submitted to the FDA. It's not all the data that is required for a full approval, but it's sufficient data to know that the vaccine is safe and effective. And the reason for the emergency authorization is to have all the data that is usually submitted for approval. You have to wait about a year because you have to follow people who've been vaccinated for a year. And the urgency was such that you couldn't wait a year before full approval. So the studies are ongoing, and full approval is probably, for some of these vaccines, is probably going to be coming this summer, because they received emergency use authorization in January, about 6 months after the beginning of their studies. So it'll be another 6 months in June, July. And by then, all the data required for full approval will be there. And I can assure you that based on what we know about these vaccines and the results that we're seeing, full approval is on its way. So I would not be too worried about emergency use versus full approval. We are seeing that they do work. We are seeing that they're very effective, and we are seeing that they are safe. Dr. Stevens and Dr. Kellermann, you may want to add something else.
Yeah, about what's the number? 250 million immunizations have been given in the United States already. In California, over 30 million. And that's, if you just want to look at that data, I mean, yeah, there've been a few allergic reactions, but nothing of any major serious nature. So although it's not enough to get FDA approval, it's certainly enough that, we can look at those numbers and feel very safe that the safety profile of these immunizations is impeccable. Parenthetically, when it gets FDA approval, apparently the UC systems will require COVID immunizations for any incoming students. So your choice will be to go to school or not in the UC system. Your choice will not be immunization or not. Certainly the UC system recognizes these immunizations are safe and effective. Alinea?
Yeah, I agree. I think the approval, I think for Pfizer, they were talking about coming at the end of this month. I'm not sure if that's but it's exciting that will happen. And like the studies from adolescents are really promising. Pregnancy, we're seeing a lot of safety data from that too. I'm very excited about these vaccines because they seem not only very effective, but very safe and a great platform for responding to like disasters like this in the future. So yeah, thanks to John there.
And yeah, so anecdotally, let me put it this way. Anecdotally, we see that the hesitancy to get any type of vaccine is much higher in the Latinx community than in the quote unquote white community. So could the county do more outreach to that community? And because these are numbers that are California numbers. So I'm just wondering if Nevada County, do we have any, first of all, do we have any data? And B, is there anything more that you can do?
Oh, Glennah.
I'm sorry, I don't have data at my fingertips, so I do not know. But we do know that people who do not have a medical provider, who have difficulty in accessing medical care, tend to be hesitant about these vaccines. And yes, in Nevada County, we are doing surveys and we're starting to develop a plan to do more outreach. We need to understand who are the trusted folks in all the communities where people are hesitant to have the vaccine, so that those trusted messengers can give them the messages of the safety and the effectiveness of the vaccine. There's a lot of data that shows they're safe and effective. Sometimes you have to appeal to people's hearts, not just to their minds, and we need to understand how to do that.
Hey, Glennah, you want to compare Mexico and the US with respect to pediatric immunizations?
Well, the United States doesn't do very well with immunizations in general. In Mexico, they have a very good program for childhood immunizations, where all birth certificates are sent to the health department, and immunizations are available and free for children. And if parents don't show up at the clinics with their child at the appropriate times, 2, 4, and 6 months for the initial series of vaccines, someone will visit the home and offer the vaccines in the home for the children. So the childhood immunization rate in Mexico, at least a few years ago, was over 90%, much higher than pockets of the United States, where we have much lower immunization rates.
Thanks, Glennah.
So I'll just chime in with the data. I'm sorry, but the state website, the state dashboard does have the ability to look at the data by county, by race and ethnicity. So you can go out there and look at that. It's currently showing, and the data is, I should provide the caveat that it's not perfect. And again, it doesn't totally link up with what CDC shows, but it indicates 19.8% of our Latino community fully vaccinated and 12.5% partially vaccinated, which is well behind what it categorizes as white, which is 37.5% fully and 12.7% partially vaccinated. So I would say we absolutely can do better. We're trying and we're working on it, and we have our clinic in Truckee is specifically reaching out to their client list and calling people. And there was an anecdote of somebody who was hesitant and talked to somebody on the phone and brought in their entire family of 8 people to get vaccinated. So it's more slow and intentional work, I think, but we definitely have work to do.
And speaking of Truckee, we have a question. Person says, I live in Truckee, and back on April 21st, I had to go all the way to Woodland to receive my first Moderna vaccine at a CVS. Are there any locations near me in Truckee to receive a second Moderna vaccination? All the locations near 96161 seem to be offering Pfizer or J&J.
I think we found out yesterday that the Safeway in Kings Beach gives Moderna vaccine.
Yes, it is.
So that may be a place to call and get that vaccine.
I think so does Tahoe Forest Hospital. I mean, my understanding is only the CVS in Truckee is giving Johnson & Johnson, or I'm sorry, Pfizer, but But and originally we were telling people go back to where you got your first dose to get your second dose, and that's no longer something that's required. But yeah, I think almost everywhere that's giving vaccine in Truckee is giving Moderna.
And I just put the vaccine provider, the URL, the county's vaccine provider list in the chat. So hopefully all the info will be there. And then Cornelia has a question about, will Nevada County schools be requiring that students who are eligible be vaccinated for the start of the 21-22 school year? Do we know?
Well, that's a politically hot potato, so I'll refer that to Glennah.
Well, the answer would be, I don't know, Ben. I think that really is a question for the schools. We don't, we advocate for vaccines. We want everybody who qualifies for the COVID-19 vaccine to have it. But the decision as to whether to require it or not is not really up to us. And I think that's a question for the school.
And this question, is a June golf tournament of about 250 individuals okay per California or county guidelines? Person has trouble deciphering the outdoor gathering guidelines. 250 people.
If somebody's interested in these tournaments or events, just contact public health and give us, your parameters and what your plans are, and it's a conversation. We were on a call yesterday with respect to a golf tournament outside of Truckee, and it's all going to work fine. Golf is a sport that is outdoors. There's some distancing there already. Viruses aren't spread well outdoors, and with masking and certain prescriptive practices, it should be fine. It's just the indoor gatherings, the hospitality gatherings that could be problematic. So I'd say whoever's organizing it, just give us a call. I think, Glennah, weren't you saying that golf was considered an essential activity?
Well, initially, when the closures occurred last year, that is true. It was declared that golf courses did not have to close down. I think that was more political than a science-based decision at that time.
Now that we are approaching our pumpkin time here, so the important stuff for this week is that there are now, no need for appointments at the Whispering Pines and the Sierra College Clinic. You can just walk up there and get your vaccine. And if I'm not mistaken, it's Pfizer at Whispering Pines and Moderna at the Sierra College.
Yes.
Okay. So there's that. Any Johnson & Johnson available in one of the county clinics?
I don't believe that we are giving the Johnson & Johnson in the clinic itself. It is being used for folks that where the reach team needs to go, because it's much more convenient to have one dose rather than to have two.
Mm-hmm.
However, I will defer to Ryan or Dr. Kellermann. They may know better than I do.
That's true.
Yeah, I don't have any more information.
Okay, Alinea, with Chapa Day, your patients, which vaccine do they get?
We have Johnson & Johnson and Moderna, and we do have it every other week, but we have actually not seen very many people come in for their Johnson & Johnson vaccine. So we're talking about what else to do there. But yeah, if you're a Chapa Day patient and you want a Johnson & Johnson vaccine, yeah, please feel free to come on in. We'll get you on the schedule.
Great. Any last words of wisdom?
Well, so we were on a vaccinator call, and Alinea and I were the other day, and just a quote from Mother Teresa: "The greatest disease in the West today is not TB or leprosy; it's being unwanted, unloved, and uncared for." And I think we've had problems with COVID, the masking, and we call it social distancing. I hate that term. It's physical distancing. There's no reason if you're physically distanced why you can't socialize in a way that's creative and kind of meets the needs of others. So that's what I encourage. I think those are the watchwords to that we need to open our hearts to others, and including people we disagree with, maybe about immunizations and even politics, because I think if we kind of look at those as just issues and not really impediments to a relationship, that this county and this nation will be moved forward in a positive way.
So these aren't words of wisdom necessarily, and that's a tough act to follow, but I'll just say, if you're like me, I have 2 kids who will potentially be eligible to be vaccinated once the FDA opens up Pfizer for 12 and over. And so I'm very excited about that. And what I hear from the state is that that they're going to be moving to authorize or review to authorize shortly thereafter, and updating my turn as soon as possible after that, so that we can start registering kids. So keep your eyes peeled if you're looking to get your kids 12 and over vaccinated, for more announcements next week.
I just want to add that if you're on the fence and you have any questions, like, talk to your doctor. We would love to have those conversations.
But I also think that just having conversations in the family, with your family and your friends. I know that talking to people who were a little reluctant, or who were considering waiting because it was like, oh, I'm not sure. Just talking to people, and because as a fully vaccinated person, I can say that the relief that once you're fully vaccinated, and those 2 weeks, after the 2 weeks, it was like, it's amazing, because it feels good to have the protection, but also to contribute to this common good, to the community, because it's me being vaccinated means that the next time I go out and I have to take some pictures or something, I'm not going to infect you, and that makes me feel really good. So I have to say that's something we all need to keep in mind, that we're not doing it just for us, but also for everyone else who lives here, because that's the thing, we all live here. So with that, thank you very much, everybody, for showing up week after week, and hopefully next week we get to talk about how the kids can get vaccinated, and what the process is. Parents have to be with them, etc. And so, and from there, until then, everybody stay safe, enjoy this gorgeous weather, please don't start any fires, and get vaccinated if you're not.
Thank you.
Thanks.
Bye.
Bye.